Hi everyone, my name is Elena Bransford and I'm going to be discussing and kind of helping you understand the current and growing opioid epidemic in our nation. So for years, opioids have been around. They have been used for a lot of different reasons. When they were first introduced in the 1800s, they had been referred to as a wonder drug or a miracle drug just because of how powerful they were and how many different uses they had in the healthcare field. So opioids like morphine, hydrocodone, Vicodin are probably some that you've heard of. Those were actually initially created and prescribed for patients with extensive pain from chronic illnesses or even post-surgery pains. But over the years, these medications have become a lot easier to obtain because of how quick physicians are to prescribe them to their patients. So not only does research show astounding addiction, treatment, rehab, and incarceration rates, but it also shows that opioids are at the top of drug overdose rates. So more and more families in America are being affected by this existing and growing opioid epidemic. It's important for society to understand what they are, their history, how their inappropriate uses are affecting communities all over the nation so that the epidemic can hopefully be stopped and reversed eventually. So first, I want to talk about the history of opioids and their misuse. The history dates back all the way to the 1800s, and that's with the abuse of them included. Morphine was one of the first ones that I talked about and one of the first ones to settle in the United States. It was available during the Civil War for hurt soldiers, actually, to reduce their pain from the injuries that they had sustained. The renowned company Bayer, however you choose to pronounce it, later produced heroin in 1898. So although they were known for their extreme pain-reducing abilities, people began using them as a cough suppressant or less serious reasons. And that was before doctors even realized their extremely, extremely addictive effects. It wasn't until the 1990s that opioid prescriptions had escalated seriously. And at that time, the medical community was being told by pharmaceutical companies all over that you could not even become addicted to opioids or things like that, things of that nature. In 2012 alone, though, actually, doctors wrote 259 million prescriptions for opioid painkillers. That's enough to give every adult in the country their own bottle of painkillers, and that's a little absurd. Beyond the staggering rates of prescription drug use, there was also a spike in illegal heroin trafficking in the past 10 years. So both overprescription of opioids and heightened heroin trafficking formulate an unparalleled opioid crisis. That it's like basically inevitable at that point. So next I'm going to talk about the ignorance of drug usage and how it can lead to overdose. So every day, someone loses their life due to an opioid overdose. The current epidemic has been acknowledged as a national public health emergency, and according to the Center for Disease Control and Prevention, heroin and prescription drugs has killed over 33,000 people in just 2015 alone. That's a staggering rate, and that's so unfortunate to even read and be able to hear. It just doesn't add up, and it is an epidemic, and it should be reversed as soon as possible. So the process of reversing the epidemic won't happen overnight. We know that. But with persistence and knowledge of the topic, it can happen over time. But finally, I'm going to discuss the treatment and incarceration rates of opioid addicts. Jails all over America are filling with opioid users. Should jails be creating programs to help the people who are incarcerated for those certain offenses? That's been a question that has been prevalent and relevant for years, along with the question of if addiction is a disease. If it is, do opioid-dependent inmates have the opportunity to attain treatment while in jail? It would decrease the numbers of deaths due to overdose significantly, widely all over America. And something that is used all over, but not as prevalent as it should be, are methadone clinics. And I'm going to explain to you what methadone is. It basically is a synthetic opioid or painkiller. It's used to treat chronic pain, but it's also been used for several decades as treatment for people with opioid dependency. And then what is shocking is that actually less than 1% of jails and prisons allow it to be used currently. In 2001, a study at which started one of the country's original jail-based methadone clinics and programs in 1987 found that participants were less likely to commit new crimes and more likely to continue treatment after being released. So that 2014 study was from Australia, and found that fewer overdose deaths were listed after people were released from jails. So inmates with certain programs that give them this opportunity have more of an advantage on getting onto the road to recovery and over those addicts who don't have that opportunity in jail. So I feel like the more jail-based programs we have will increase likeliness of addicts becoming clean and helping them become sober. The more jail-based programs we have, obviously, the better, I believe. It can't hurt anyone. It can only help someone, As I conclude, I would like to talk about how opioid addiction has actually affected me personally and had a negative impact on my family's life. And now, unfortunately, my friends, because over the past week, I actually had a classmate that I graduated with in 2017 pass away from opiate overdose, and it's so unfortunate because she's one of the smartest, most brilliant people that I've ever met. Known her since 7th grade, and you would never think that a drug would be able to take over someone who's as vibrant and full of life like her. But it is something that people struggle with, addicts struggle with day to day. It's a day-to-day fight in staying clean and remaining sober. But it also, I've seen it in my immediate family with the cycle of how you get clean and then you relapse and you are put in jail for something you did while on drugs or being caught with drugs. And the cycle is extremely vicious, which is why programs are very, very important. And I feel like they would help immensely in the community of drug users. So the war on opioids is more serious than ever right now. Seeing personally how easy it is to become addicted and then to remain sober after you've become clean, I believe much more could be done to help reverse the epidemic. Scientists and doctors all over have been spending decades researching and pressing in to find out what could possibly work best to help reduce opioid addiction and even possibly reverse the known epidemic. But it's hard. It's a lot of work, and it's not going to happen overnight, like I mentioned, and it's going to take time. But with persistence and consistency, just like anything else, it can happen. People are searching for things that will help addicts in jail, out of jail, different types of treatment. The research has been going on for a while, quite some time, and with the help of communities and just pressing in and continuing to love on people who are affected by addiction of any kind, really, it can be done, and I believe that it will be done eventually. That's a good thing, and it's exciting. So with continuous research and based off the previous trials that I kind of talked to you guys about a little bit, I definitely 100% believe it can be done, can be reversed. And with unity in the communities that struggle, and even those helping that see the communities that are struggling and suffering indeed is the word, because I've seen it and it is truly vicious. It's not pretty. It's not at all. And that's why I'm so passionate about this subject, is because I've seen it firsthand and I've been affected by it firsthand in my immediate family. And it is so sad. What it can do to people and families is it's tragic and it's unfortunate, and no one should have to ever go through that. So I believe it can be solved. So just, if you know someone that's personally affected, just love on them and just do whatever you can to help them. If they're not the one that's personally struggling with it, but they have been affected by it, then just be a person that can be a light, because it does take a negative toll on people who are affected by it. So yeah, I hope I helped you guys kind of understand what opioids are, their history, and what they can do to negatively affect and impact a person and their family, their communities, and how it currently is affecting our nation right now. So I hope you enjoyed, and thank you so much for listening. Bye.